Today, we're talking about a huge update coming to the treatment of leprosy, one of humanity's oldest known diseases. And this isn't just a minor tweak, it's a fundamental change to the standard of care, and it's happening very, very soon.
You know, you don't often see a complete do-over for a disease that's been around for literally thousands of years. What we're looking at is a major shift designed to make treatment simpler, way more effective, and a whole lot easier to get to everyone who needs it.
And get this isn't some idea floating around for the future. There's a hard date. Mark your calendars for April 1st, 2025. That is the official launch day for these new guidelines, kicking off a brand new, unified way of fighting leprosy. Okay, so where do we even begin with these changes? Well, it all starts right at the beginning, with the diagnosis itself. The new guidelines are totally redefining the two main forms of leprosy, and this is to make sure every patient gets classified correctly right from the get-go.
All right, so here's the new breakdown. It's super clear-cut now. On one hand, you have paucibacillary or PB leprosy. Think of this as 1 to 5 skin lesions and no nerves involved. On the other hand, you've got multibacillary or MB leprosy. This means 6 or more lesions or at least one affected nerve. That's it. This simple distinction is the bedrock for the entire new treatment plan.
And this is the real game changer. Forget about different treatments for different types of leprosy. We're moving to one single 3-drug regimen that's going to be the standard for every adult patient. All right, let's break down this new 3-drug cocktail. First up, we've got rifampin. And the dosage? Super simple, 600 milligrams, and you only take it once a month. Okay, drug number 2 is dapsone. This one's a daily pill, 100 milligrams. So you've got your monthly pill, your daily pill. What's the third piece of the puzzle? The last drug in the trio is clofazimine. Now, here's the cool part. The way you figure out its dosage is actually pretty clever and makes it incredibly easy to remember. Let me show you how it works. It's this super easy half-and-half rule. You just take the other 2 drugs and cut their doses in half. So half of the rifampin dose, that's your monthly clofazimine dose, 300 milligrams. And half of the dapsone dose, yep, that's your daily dose, 50 milligrams. See, super simple, right? It just makes it so much harder to get wrong. And as if that wasn't simple enough, they're taking it one step further. All 3 of these drugs, they're going to come prepackaged in one single maroon-colored blister pack. One packet, one standard treatment for every single patient, no matter their classification. No guesswork involved. Okay, so if every single patient is getting the exact same 3 drugs, you're probably asking, what's the difference then? How do you treat the 2 types of leprosy differently? And the answer is actually really straightforward. It all comes down to time. So for patients with that less severe form, the paucibacillary or PB leprosy, the treatment is for 6 months. They take that standard 3-drug pack for half a year, and that's it. Treatment done. But for patients with the more serious multibacillary or MB form, you just double it. Simple as that. A full 12 months of treatment. Same exact meds, just a longer course to make sure you wipe out that more stubborn infection for good. Okay, let's zoom out for a second. We've gone through the new drugs, the new timelines, but why does this actually matter? What's the real-world impact of simplifying the treatment for a disease this old? It really all boils down to 3 huge wins. First, you've got standardization. One drug packet for everyone. That just cuts out so much confusion and potential for mistakes. Second, the treatment is actually stronger now. Even patients with the milder form are getting this powerful 3-drug combo, which means better results. And finally, clarity. The only thing that changes is the length of treatment, 6 or 12 months. It's just a cleaner, smarter, and way safer system. You know, this whole update is such a great reminder that the biggest breakthroughs in medicine aren't always some brand new, futuristic discovery. Sometimes it's about looking at what we already